Hello everyone, welcome to my YouTube channel. Today we are going to cover regarding intervertebral disc part 1. In part 1, we are going to learn about anatomy of the intervertebral disc. Before we start, there is a disclaimer. This video is for informative purposes only. I am advising you to refer to the main textbook or sources that is used in each teaching center respectively. Thank you. Now let's begin. So what is intervertebral disc? The discs are fibrocartilagenous cushions. Among its function is to act as a spine shock absorbing system. It prevents the vertebra from grinding together. The intervertebral discs allow the spine to be more flexible without sacrificing the strength. With some vertebral motion, example, flexion and extension. The intervertebral discs account for 25 to 35% of length of the spine. There are 25 intervertebral discs normally, 7 at the cervical, 12 at the thoracic region, 5 at the lumbar region, and 1 in sacral region. There are no discs between atlas C1, axis C2, and coccyx region. The intervertebral disc composed of 3 major components: the inner or nucleus pulposus, NP, the outer or annulus fibrosus, and the cartilagenous endplate that anchor the disc to the adjacent vertebra. Regarding the anatomy of the intervertebral disc, I am starting with the inner component or nucleus pulposus. Nucleus pulposus is a gel-like structure that sits at the center of the intervertebral disc and responsible for the strength and flexibility of the spine. It is made of 66% to 86% of water, with the remainder consisting primarily of type 2 collagen. Nucleus pulposus may also contain type 4, type 5, and type 6, and with proteoglycan. The proteoglycan include the larger aggregan and vesican that bind to hyaluronic acid and several small leucine-rich proteoglycans. Aggregan is largely responsible for retaining water within the nucleus pulposus. This structure also contains low density of cells. These cells produce the extracellular matrix ECM products, example aggregan, type 2 collagen, etc. etc. And it maintains the integrity of nucleus pulposus. The annulus fibrosus AF is a ring-shaped disc of fibrous connective tissue that surrounds the nucleus pulposus. The annulus fibrosus is highly organized, consisting of 15 to 25 stacked sheets or lamella of predominantly collagen, with interspersed proteoglycans, glycoproteins, elastic fibers, and connective tissue cells that secrete these extracellular matrix products. In annulus fibrosus, each lamina contains collagen uniformly orientated in a place that differs in orientation to the adjacent lamella about 60 degrees. This alignment leads to a parallel orientation of alternate lamella. This radial ply formation provides exceptional strength compared to an entirely longitudinal step-up. Okay, in this picture, it shows a summary regarding the characteristic of intervertebral disc, including the annulus fibrosus and nucleus pulposus. Regarding the collagen network, in annulus fibrosus, 65% to 75% of annulus fibrosus is a dry weight. It consists mainly of type 1 collagen, 50%, type 2 collagen, 30%, around 15 concentric bands in figure 8 arrangement, whereby in nucleus pulposus, regarding the collagen network, only 20% are dry weight, with predominantly type 2 collagen 50%, type 1 20%. Its arrangement is a tangle fibers. For proteoglycans and water content, in annulus fibrosis, 30% of annulus fibrosis is dry weight. It contains around 60 to 70% of water, and there is no change in the components throughout the life. For nucleus pulposus, 60% of nucleus pulposus are dry weight. In childhood, 90% of nucleus pulposus contains water. As the patient getting older, the water content decreases with age. Regarding the cells content, in annulus fibrosis, it has around 9,000 cells per millimeter square feet, with elongated cells lying parallel to the collagen, and it has fibroblastic phenotype. In nucleus pulposus, it has around 30,000 cells per square meter. There is coexistence of two types of cells until skeletal maturity is achieved: the notochordal cells and the cells showing a chondrocytic phenotype. What is the function of intervertebral disc? Intervertebral disc, within the disc itself, the separate components serve different purposes. The nucleus pulposus serves to disperse the force placed on one aspect of a vertebral body to the entire structure by virtue of its high water content. The annulus fibrosus serves to encircle the nucleus pulposus as a cage to provide structure to the gelatinous form. The radial configuration in annulus fibrosus allow for increased resistance to the compressive forces, resist torsion, flexion and extension movement of the spine. A popular theory regarding the fluid mechanics, it is influenced by the motion of the lumbar vertebral segment. During standing, the body weight causes the nucleus pulposus to move sideways, as shown by this picture. Mackenzie et al. Described the flexion and extension motion of the spine as having clinically effects on the nucleus pulposus direction of movement. When the spine moves from extension to full flexion, the nucleus pulposus tends to displace or move posteriorly. When the spine movement from flexion to extension, the nucleus moves anteriorly, as shown by this picture. Regarding embryology of intervertebral disc, the intervertebral disc is derived from embryonic structure called the sclerotum and notochord. The nucleus pulposus, the cushioning core of the mature intervertebral disc, is derived from notochord, while the annulus fibrosus, which provides the structural properties of the disc, is derived from sclerotum. The sclerotum is derived from somites, a transient structure that determines the segmented nature of the embryo. And in response to signals from the notochord and floor plate of the neural tube, the maturing somites undergo dorsal-ventral compartmentalization, establishing a dermomyotome and sclerotum. Sclerotum form most of the connective tissue of the future axial skeleton. The development of sclerotum is characterized by proliferation and expansion of cells as well as the formation of three subcompartments: the ventral, the lateral, and dorsal. The ventral sclerotum gives rise to the vertebral bodies and Annulus fibrosus. What is the blood supply to the intervertebral disc? The intervertebral discs are largely avascular. Only the outer annulus is vascularized. Blood vessels near the disc bone junction of the vertebral body as well as those in the outer annulus supply the nucleus pulposus and inner annulus. This picture shows the pathway of nutrient supply in a normal intervertebral disc. The avascular intervertebral disc is supplied by surrounding vertebral blood vessels and nutrients. It must diffuse from the outside of the disc inwards down their concentration gradient. Glucose, oxygen, and other nutrients reach the avascular regions by diffusion. The same process removes the metabolites based on diffusion gradient. Nerve innervation in the intervertebral disc. Only 1/3 outer of annulus fibrosus is vascular and innervated in a normal condition. In aging and states of inflammation, nerve growth and granulation tissue growth are stimulated. Additionally, the granulation tissue secretes the inflammatory cytokines, which further increase sensitivity to the pain sensation. Okay, that's all for today. I already covered regarding part 1 of the intervertebral disc that cover the anatomy of the disc. In part 2 of the intervertebral disc, I will cover regarding the disease that is associated with the intervertebral disc, example prolapse disc. Thank you. Till we meet again. See you. Bye.